Hello everyone, welcome to our channel. My name is Shrujna and today we are with Dr. Harshit Javalkar. He is one of the leading orthopedic surgeon in Hyderabad who is also exclusively specialized in the shoulder surgery from prestigious King's College Hospital in London. Let's also meet the managing director of the shoulder center. Let's welcome him. Hello sir, how are you doing today?
Hello Srujana and Namaste viewers. I'm doing very well. Thank you so much for having me on this channel. It's my pleasure to be here.
We are so glad that you are here with us.
Pleasure is all mine.
So sir, please explain us about the common causes of the shoulder pain.
Yes, of course. So a bit of a background about the shoulder. So the shoulder is a pretty complex joint. So it has a ball which is quite big, which is sitting in a shallow socket. So to keep that big ball in the shallow socket, it needs a lot of soft tissues, structures which support the joint. So it has a pretty complex function. It not only needs strength, for example, when you're lifting heavy stuff, when you're pushing something, it also needs a lot of flexibility, so it can reach wherever it wants to, front, back, low, up. So it needs a lot of mobility, and it also needs a lot of stability to keep the ball in the socket joint in all these different positions. So it's a quite a delicate piece of equipment, and because of that there are lots of things that can go wrong with the shoulder and can cause pain and stiffness of the shoulder joint. One of the most important, one of the most common causes of pain and stiffness around the shoulder is a condition known as frozen shoulder. It is also known as adhesive capsulitis in medical terminology, and previously, historically, it was also known as periarthritis, but which is not very accurate description. So in this condition, there is a lot of inflammation of the soft tissue structures of the shoulder, which can cause a lot of pain and stiffness. It is very common in patients who are diabetic, and fortunately it is a very easy condition to treat. The results of treatment are very good. The second most common cause of shoulder pain is a condition known as subacromial impingement. Don't get worried. So basically I'll explain to you. Basically the soft tissue structures which are present in between the ball of the shoulder and the roof of the shoulder, the acromion. In between these two structures, in between these two bones, the muscle and the bursa, it's a bag of fluid there, it gets pinched. So if you imagine the hand going up, the space automatically reduces and there is pinching of the muscles, the tendon there, and it causes pain. Again, this is a very common condition, but luckily it is quite easy to treat. All it needs in the majority of the patients is good physiotherapy to improve the muscle strength, and at best it might need an injection into the joint. Continuing in the same cause, rotator cuff tendinitis or problems of the rotator cuff also can cause a lot of problems, a lot of pain around the shoulder joint. It is a relatively common cause. So if this pinching of the tendon, it goes on for a long time, there can be swelling and inflammation of this important muscle, this important tendon which keeps the ball into the socket. So if there is inflammation, it is known as tendinitis. If the tendon keeps getting repeatedly irritated, if it keeps getting pinched in between the bones, it can develop a lot of wear and tear. It can get torn also in severe cases due to the friction between these two bones. So rotator cuff tears, whether it is due to repeated overuse or whether it is due to a single episode of injury, say for example somebody is falling and they try to stop themselves by putting their hand, or whether they are involved in some accidents. So this important muscle, this important end of a muscle which is known as the tendon, it can get torn and can cause problems with the shoulder joint. So diagnosis is a little bit more tricky. It needs an examination by a specialist. It needs some advanced imaging like ultrasound scanning or MRI scanning, and then it depends on each person. It might need physiotherapy only, or it might need a repair. It might need surgery in the form of keyhole surgery to repair these stone structures. Another important cause is sports injuries of the shoulder. It's very common in it's very common in people who play overhead racket sports. For example, tennis or badminton, squash, even volleyball, bowling also during cricket can cause injuries to the shoulder. So they can involve the muscles, the tendons, the ring of cartilage, which is known as the labrum. So lots of things can go wrong with sports injuries around the shoulder. Of course, major accidents, road traffic accidents can cause fractures or dislocations, or both fractures and dislocations of the shoulder joints, which need emergency treatment. Arthritis is one of the relatively uncommon causes of shoulder pain in the Indian population. There is wear and tear of the shoulder joint. The ball and the socket joint can get worn out because of overuse, because of chronic injuries, soft tissue injuries like rotator cuff tears, and cause pain around the shoulder. So this was sort of like the broad overview of the different causes of shoulder pain which can trouble the patient. So the important thing is to not neglect any of these. Timely treatment, whether it is just medicines, whether it is physiotherapy, whether it is identifying the problems which in the shoulder joint, identifying other problems which could be contributing to the shoulder joint, like for example diabetes can cause frozen shoulders, so identifying diabetes is an important part. So early identification, early treatment is key. So I urge my viewers to not neglect their shoulder pains and to come and see the specialist as and when needed.
So thank you so much, doctor, for giving us informative details on the most significant body part, that is shoulder.
Thank you so much, Srujana and Suman TV. It was an absolute pleasure talking to you, and all the best to our viewers.
Viewers, please like, share and comment. You can always drop a question that you wanted to ask to a doctor in the comment section below, and please call to the number which are scrolling in our video. Plus, you are always happy to visit the Shoulder Center, which is located in row number 12, Banjara Hills. Thank you so much for watching this video.